Hey, everybody, welcome to the Nutritional Frontiers webinar. I am super excited to have Dr. Len Brancewicz online with us tonight talking about probiotics to support your GLP-1 patients. Dr. Len, this is a huge topic right now. I know there's a lot of questions, so I'm super glad you're here. I'm Dr. Tracy. I'm really looking forward to seeing everybody in the upcoming events. If you haven't checked those out, please go visit our website. All of the events, webinars, everything that we're doing here in the educational space, including the new NFU EDU, is coming up. So go check that out on the website, nutritionalfrontiers.com, underneath education. So, Len, I'm going to let you take it away. If you need me, I'll be in the background.
There you go. Welcome, everybody. Tonight, we're going to explore what, in my opinion, could be one of the best entries into the nutraceutical world in the last 10 years. Since I've been doing this for such a long period of time, it takes a lot for something to really grab my attention and really focus me. But over the last 6 months, a couple new products came to the table, and the one we're going to talk about tonight, called Probio 3, came up at a specific time. And I don't believe in coincidences at all, that this particular prep became available right when it seems like 80% of all Americans are on some form of a GLP-1, that the whole world now wants to get skinny. And everybody's trying to get those. You even saw that the president went as far as trying to get a lower price on the GLP-1s. So tonight we're going to talk about the intersection, and this is what I like to call it, the intersection between gut health and metabolic medicine. That's a crucial factor. We're going to discuss how probiotics, prebiotics, and postbiotics complement GLP-1 therapy. How do they do that? It does it through gut microbiome support. We're going to try to cover science, which is what I really like to do, get into the science of this, specific strains of the probiotics, and a practical application for all of us, whether you're a practitioner or you're just a patient. How does this fit into what you're doing? We're going to focus on one of the ingredients in here we're going to spend some time on, called Lytese. It's a registered trademark prebiotic fiber that enhances probiotic functioning. So it's like a supercharger. It works to be able to enhance probiotic functioning. Now, Lytese is a polydextrose. It's a synthetic soluble bulking fiber derived from corn-based raw materials. It's produced by the high temperature polycondensation of glucose, roughly 89%, with a little sorbitol and citric acid. You don't need to know that, but that's from the biochemistry side. This process creates a randomly cross-linked polymer used to replace sugar, fat, and calories in food products. That's where it came from. So when we get Lytese, it's produced through what's called thermal polymerization to achieve high purity and superior focus. So we're going to take a look at this. We're going to highlight this, and we're going to talk about it. But the first thing that we have to do is go to the next slide, please. We're going to have to understand what a GLP-1 is. GLP-1s are naturally produced by the L cells in our intestines. When is it produced? When we eat. It's part of what they call the incretin system that regulates metabolism. So our metabolism is regulated once food gets into our system by these L cells in our intestine to produce a sufficient amount of GLP-1 to handle the metabolism. Three main functions. What do GLP-1s do? The naturally produced GLP-1s in the human body. They increase insulin. Why is that important? So that we can utilize our blood sugar at a different level. So when we want to utilize blood sugar, we need a certain amount of insulin to do that. We also know that GLP-1s slow digestion. That's why everybody's so hepped up on these. I'm not hungry anymore. It slowed my digestion down and it reduces appetite. Those are the three major focus points of GLP-1s. Now, GLP-1 medicines are really effective because they do all three. And you see on this little chart, you see Ozempic, Wegovy, all the different forms that are out there, the tirzepatide, Mounjaro, and Zepbound, which are the newest ones, the newest introduction into the GLP-1 field. Semaglutide, the Ozempic, Wegovy is probably the most well-known. These are all GLP-1 receptor agonists. They mimic natural GLP-1. This is a critical factor to remember. They mimic natural GLP-1, but last much longer. Tirzepatide is actually a dual agonist, GLP-1 and GIP. It's even more effective. So out of that grouping, tirzepatide actually is the more effective of the preps. Now that we understand what GLP-1 does, let's move on to see how does the gut microbiome naturally help in the production of GLP-1s. Let's go to the next slide. The gut-brain metabolic axis. This slide shows what I call the fascinating connection between the gut bacteria and metabolic health. See where it starts: gut microbiome, GLP-1 production, metabolic benefits. Think of it as a three-step pathway from microbes in the gut to metabolism. So we'll just walk through that first column, the gut microbiome. Our gut contains trillions of bacteria that acts like a metabolic factory. The gut microbiome produce what are called short-chain fatty acids. Short-chain fatty acids. I'm not going to go into the reason and rationale, but it's a part of the digestive system that is critical for the assimilation of nutrients. One of the most important short-chain fatty acids is butyrate. They metabolize tryptophan, yes, that amino acid that we get from turkey. They modify bile acids into different forms. All these activities send signals to our intestinal cells. So all of this metabolism, all of this bacteria that's doing what it needs to in the gut to produce short-chain fatty acids. Next, we go to column 2, the GLP-1 production, the butyrate. Butyrate directly stimulates what I said earlier, the L cells. What do? The L cells release the GLP-1. Tryptophan metabolites activate special receptors. You don't need to know this. They're called AHR receptors that increase GLP-1 gene expression. So they make the GLP-1 entities more effective. The secondary bile acids activate what are called TGR5 receptors, another pathway. That's another one that stimulates GLP-1 release. These multiple pathways mean multiple opportunities for intervention. So you see, we start in the gut. We take care of the short-chain fatty acid production, which goes to stimulate the L cells by the production of butyrate to produce GLP-1. Tryptophan metabolites activate, and now we have a two-pronged approach for the production of GLP-1s. Metabolic benefits in that last column, the end result, better blood sugar control, improved glucose control, reduced appetite, enhanced insulin functionality. That was the goal of the development of these preps. This is the body's natural GLP-1 system working optimally. When this situation where the gut microbiome is producing short-chain fatty acids, which stimulate butyrate, which allows for the metabolism of tryptophan, that's when the body is working at its best. We all know somebody that seems to be able to eat just about anything and keep their weight right where it needs to. We also see a lot of people, like my wife, who just doesn't seem to be hungry all the time. You know, we do the one meal a day and we do just fine. So you see a lot of different people that are producing different levels of this. so that they're able to keep their appetite under control. When the microbiome is healthy, all these pathways function better. So the question becomes, how do you optimize these three pathways using probiotics? Next slide, please. Let's walk through three proven mechanisms by which probiotics enhance GLP-1. Number one, there it is in green, short chain fatty acid productions. This is the most direct pathway. Probiotics ferment the dietary fibers we consume that we can't digest ourselves. Okay, we got that. The probiotics ferment the dietary fibers we can't digest on our own. They produce butyrate, propionate, and acetate. Butyrate is the star here. It's the preferred fuel for colon cells and directly triggers GLP-1 release. In other words, the more beneficial bacteria we have equals more fiber fermentation, which equals more butyrate, which equals more GLP-1. Follow these steps again. More good bacteria, more fiber fermentation, more production of butyrate, more GLP-1 is produced. Okay? That's a critical factor. Mechanism number two, the tryptophan metabolism. The bifidobacterium species are particularly good at this. They break down dietary tryptophan into metabolites. The metabolites are called indole compounds. These activate what are called aryl hydrocarbon receptors, AHR, in our intestinal cells. This upregulates pro-glucagon gene, which is a precursor to GLP-1. Pro-glucagon gene expression is accentuated, upregulated. It's a precursor to GLP-1s. It's a more indirect, but a powerful pathway for the production of GLP-1s. So that's number two. Number three, bile acid modulation. Probiotics have enzymes that modify bile acids. They deconjugate primary bile acids into secondary forms. These secondary bile acids, like deoxycholic acid, are potent activators of the TGR5 receptors. TGR5 activation stimulates both GLP-1 and energy expenditure. Why is that important? That's called the metabolic burn. When we have the energy expenditure, it's a win-win for metabolic health. So the summary statement on this. Three independent pathways, all leading to enhanced GLP-1. This is why probiotic intervention shows great promise here. Next slide, please. Not all probiotics are created equal for this purpose. That was the critical factor that went into the production of this Probio 3. 5 strains have the strongest evidence for metabolic support. They're all listed there. Akkermansia mucinophila. This is the lean bacteria, strongly associated with healthy body weight. It lives in the mucus layer and actually is utilized by the human body to strengthen the gut barrier. So Akkermansia levels at the highest level, less leaky gut syndrome. Studies show it's depleted in obesity and in diabetes. Supplementation improves metabolic markers in all the human trials that have been done. It's a keystone species. When it's present, other beneficial bacteria thrive. That's why it's at the top of the list. So when Akkermansia is at its highest levels, all other bacteria levels thrive. Number 2, Bifidobacterium lactis B420. This is a specific trademarked form of Bifidobacterium. This strain has excellent clinical evidence for weight management. What's fascinating is that it increases Akkermansia abundance. So it's in the system It's in this particular formula for the production of Akkermansia. It works synergistically with pre-fibers, like the light teas that we're going to be talking about in a minute. Helps to control fat mass while preserving lean body mass. Has a great safety profile, well tolerated. So two probiotic strains so far, Akkermansia, Bifidobacterium lactis. Number 3, Clostridium. As the name suggests, this is a major butyrate producer. As you see on the tail end of the name of this, Clostridium butyricum. It is a producer of butyrate. It's a more direct pathway to direct GLP stimulation. It also produces antimicrobial compounds that help to shape the microbiome. It's been used forever in Japan for digestive health. It improves insulin sensitivity in almost every clinical trial. So, Akkermansia produce more GLP-1, Bifidobacterium, energy regulation, metabolic balance, fat burning. Clostridium, major butyrate producer, helps to stimulate GLP-1 release, improves glucose tolerance and insulin sensitivity. Next, Bifidobacterium infantis, originally from infant microbiomes. Originally for infant microbiomes, but beneficial at all ages. Excellent for overall digestive health and to reduce inflammation. It's one of its key roles. It produces both short-chain fatty acids and tryptophan metabolites. It strengthens tight junctions in the gut barrier. It's a good choice for patients with GI symptoms, especially those that are running into the GI symptoms that come with GLP-1 medications. Most common side effect of almost all of the Ozempics is nausea. The Bifidobacterium infantis is in here as a way to reduce inflammation and to help support digestive health so that we can get around those kind of situations. So again, when you look at this and you say that's one of the key probiotic strains, could this not, just based on that one strain, be a perfect adjunct to somebody that's on a GLP-1 that's really struggling with nausea? Lastly is the lactobacillus strains. And there's a lot of them, Lactobacillus acidophilus, rhamnosus plantarum. Multiple species, well-studied safety profile, all generally recognized as safe. They support short-chain fatty acid production and overall gut health, often included in multi-strain formulations. They are in all of the different probiotics that Nutritional Frontiers has. They help with common side effects, such as nausea or constipation. So when we look at the two, number 1 and number 2, areas of difficulties in those on a GLP-1, nausea, stomach distress, and constipation. Now, the constipation, they can say, is coming because we're just not eating so much. But it also comes from the GLP-1s, the synthetic forms as well. So we must look for products containing multiple strains, because what we're looking for here, and this is a key word I want you all to remember, synergism. The synergism of all of this put together. Single strain products can work, but these kind of combinations work a lot better. Next slide, please. Now let's put a spotlight on Lightease. As I said, Lightease is a polydextrose, synthetic soluble bulking fiber derived from corn-based raw materials. It's available in powder and in liquid form derived from non-GMO corn, used to enhance fiber content without affecting flavor. Now, Lightease, from the studies that have been out, and we'll go through these in just a minute, it's actually a prebiotic, not a probiotic. So Lightease is a prebiotic, but it's crucial because it feeds the probiotics that we just listed, the 5 on that last page. So Lightease is feeding those 5. It's a polydextrose, a soluble fiber that resists digestion. reaches the colon intact, where these bacteria that are in our colon ferment it. It acts as a selective food source for the beneficial bacteria, made by IFF, International Flavors and Fragrances, a reputable ingredient company. IFF. So as you see with that big R that's right behind the name, it's a registered trademark product. So why combine with beta lactose, B420? Why would you combine it? This combination has been specifically studied together. This fiber feeds the probiotic, enhancing the colonization and activity. Published research shows synergistic effects on body composition. So, as far as Lytese goes, controls fat mass accumulation while maintaining lean mass, significantly increases Akkermansia levels up to 100-fold in some of the studies. It promotes satiety, helps patients feel fuller longer, supports energy balance, supports metabolic rate. It's well tolerated with minimal gastrointestinal side effects. So why does this matter? Especially for somebody that's already on a GLP-1. GLP-1 medications slow gastric emptying, which can cause constipation. Prebiotic fibers help to maintain regular bowel movements. The satiety effects complement the appetite suppression from the GLP-1 drugs. Building Akkermansia levels support long-term metabolic health. This may, and this is the key word, may maintain weight loss when patients eventually discontinue their GLP-1 medication. Be very careful how we say that. It may help to maintain the weight loss. We can't come forward and say it absolutely will. But what I've been doing with this right now is utilizing this combination, this Probio 3, with every single patient that I come in contact with that's already on one of the particular preps like Ozempic. I want to try to accentuate the effectiveness and eliminate the side effects. If they're going to be on it, let's see what we can do to make it better. And then when we come to the end of the line, the person's lost 15, 20 pounds, and the doctor is now making the call to say, I think this will be your last month. What happens when we stop? What happens when we stop? Most of the research has shown a weight gain back of about 15 to 20% in the first month. So how can we interject here to make a difference? It's a functional food, this Lytese is. So when we want to make sure that we're adding these prebiotic fibers and adding that as a synergistic effect to those other probiotics, this prebiotic fiber can help us to maintain the weight loss, And if they've made enough lifestyle changes, potentially keep the weight off and continue that weight loss as we continue to move forward. Notice I did not say that this is going to be a substitute for one of the GLP-1s. But I'm going to say that this can, as long as those lifestyle changes have been made, can be an adjunct with the synergistic effect of what's going on in here to make the situation last longer. Next slide, please. Clinical evidence. Let's look at the research that was backing these recommendations. These are published studies in peer-reviewed journals. Study number 1, VSL number 3. This is a probiotic study that was done in 2013. This was a mouse study, but it revealed the mechanism. VSL number 3 is a high-potency multi-strain probiotic. It prevented diet-induced obesity and diabetes through butyrate production. The butyrate directly induced GLP-1 secretion from the L cells. The result, reduced food intake, improved glucose tolerance. This study was the first that really opened the eyes to the pharmaceutical industry about the GLP-1 connection. 2013. Study number 2. This is in 2020. Human trial with 14 different probiotic strains. All the participants had type 2 diabetes. First of all, there was a significant improvement in blood glucose levels. Number two, there was an increased abundance of short-chain fatty acid producing bacteria in the gut. That enhanced GLP-1 production through different regulator uptake, GPR-43 and GPR-41. These are the receptors that detect short-chain fatty acids and trigger metabolic benefits. Let me say that again. These two receptor sites, GPR-43, you don't need to know that, GPR-41, are receptor sites that detect short-chain fatty acid production in the gut and trigger the metabolic effect that we're looking for. Study number 3, 2022, on gestational diabetes and pregnancy. Looked at women with gestational diabetes. It combined 3 different bacteria, Pseudarella, Bacillobacter, and Bifidobacterium. It increased GLP-1 levels during pregnancy. It improved glucose metabolism and insulin sensitivity. Important because treatment options are extremely limited during pregnancy. So, gestational diabetes study in 2022 said this kind of a concept, this isn't the exact thing we're using, but this concept was found to be safe during the course of pregnancy. Study number 4, the beta-lactase B420 plus lactase ultra study. Human clinical trials in adults with overweight and obesity. The probiotic-prebiotic combination was utilized. It supported weight management over a 6-month period of time. A dramatic increase in Akkermansia abundance in the gut. It improved body composition, more lean mass, less fat mass, and participants reported better appetite control. The evidence spans from mechanism studies to even human clinical trials. Multiple strains, multiple mechanisms, consistent metabolic benefits were found. This isn't just theoretical. And I want to make sure that we drive home the point that the clinical evidence is here for this. This prep wasn't just thrown together. This is backed by clinical evidence that shows, going all the way back to 2013, that if you do this correctly, you can hit a home run with this kind of a prep. Next slide, please. So we want to support GLP-1 medication patients. Probiotics is complementary support. Now let's talk about this application. 4 key ways probiotics provide supplemental complementary support. Ready? Number 1, it enhances natural GLP-1 production. GLP-1 medications provide exogenous or external GLP-1 receptor activation. Probiotics optimize endogenous or internal GLP-1 production. Think of it as supporting the body's own systems while medication does the heavy lifting. I like that line. May allow for lower medication doses over time. Now, let me just make a comment. What I've seen so far in talking to a lot of the doctors that have been utilizing these is we typically are starting low, seeing how a patient does, then we go to a higher dose, then a higher dose, and a higher dose. And with each bump up, we get an initial improvement, but the body sooner or later comes to a plateau. So what we're trying to do is avoid going up the scale, because as we've gone to the higher and higher doses of the GLPs, the Ozempics, the Mounjaros, we're starting to see 2 big problems surface. This is after being on these for up to 6 months. Number 1 is the eye issue. We're starting to see retinal detachment problems starting to surface. So there's been a strong recommendation for those on GLP-1s to make sure you're seeing your eye doctor. Number 2, we're starting to see hair loss. As we've gotten to the point where we've induced nausea with the GLP-1s, we've stopped the appetite almost altogether, and patients are really cutting back a lot on their protein intake. We're starting to see hair loss become a big issue with these preps. So once again, if we can support the GLP-1 medication patients, we can help to avoid most of these. Probiotics optimize endogenous GLP-1 production, as I said. So we want to manage the GI common side effects. This is huge. GI side effects are the main reason patients discontinue these preps. Nausea now is affecting 20 to 30% of all patients. Constipation is very common due to slow gastric emptying, which is what these preps are doing. Probiotics and prebiotic fibers help to normalize bowel function. They can reduce bloating and improve overall digestive comfort. Starting probiotics early in the whole run of GLP-1s, ideally before you even start the medication, may prevent some or most of the side effects. Number 3, we want to support gut barrier integrity. Leaky gut syndrome is one of the big issues which stop the bacterial presence, short-chain fatty acid production, and the natural production of GLP-1s. So, rapid weight loss can sometimes compromise gut barrier functioning. Akkermansia and other strains strengthen tight junctions. Reduced intestinal permeability means less inflammation in the colon. Lower inflammation improves insulin sensitivity. Better barrier function supports immune health as well. So, what we're finding in a lot of patients on a GLP-1 is that their immune system tends to take a hit. And we find that the majority of these patients struggling with just things like the common cold or the flu, because we've taken a toll on the gut production of the white blood cells that are there to produce and to protect us. Optimize metabolic outcomes. These probiotics can enhance metabolic benefits of the GLP-1s, better glucose regulation through multiple pathways, support for healthy weight management, improved energy balance, reduced fatigue, let me say that again, may help preserve lean muscle mass during weight loss. So, important clinical notes on this front. Probiotics are not a substitute for GLP-1 medications. They're an adjunct. Use them alongside, not instead of, prescribed therapy. Always coordinate with the prescribing physician. Monitor patient response and adjust as needed. Next slide, please. Let's get specific about what to recommend to the patients. Number 1, we got to look for a product with at least 5 to 10 different strains. Should include Bifidobacterium and Lactobacillus species at a minimum. It's a bonus if it contains Akkermansia, although this is still rare in most commercial products. It's out there, but it's rare. Clostridium butyricum is excellent, but less common in Western products. Do we have to worry about colony factor count? Colony forming units, the measure of viable bacteria, 500 million to 10 billion per serving is the effective range. That's a huge range. Remember, a billion colony factor units would fit on the head of a pin. These are very, very, very minuscule sized entities. More isn't always better. Quality and strain selection matter more than total CFU. Some products advertise 50 to 100 billion colony factor units, but that may not be necessary. Viability. Check the expiration date. Probiotics lose potency over time. Look for products that guarantee CFU through expiration, not just at manufacturing. Shelf-stable products need specialized encapsulation technology, which is what happened here in the production of Probio 3. Prebiotic inclusion. Symbiotics, the probiotics plus prebiotics show better results than probiotics alone. Look for inulin, fructooligosaccharides, or polydextrose. Lytese is the gold standard here. The prebiotic feeds the probiotic and helps it to colonize. So how about for patient guidance? Take with meals for better survival through the stomach acid. Consistency is more important than timing. Same time each day will help with compliance. If taken antibiotics, separate the probiotic by at least 2 hours. Expectations: don't expect immediate results. Microbiome changes take at least 2 to 4 weeks to manifest. Metabolic benefits, the full benefit of what we're talking about here and the synergism, can take up to 2 to 3 months to fully develop. I'm going to tell you that most individuals are on a GLP-1 for at least 3 to 4 months. So if we start early enough, and the recommendation here is if we're going to start on a GLP-1, if we're going to start on one, start on it before you actually start the GLP-1. Start it at least a month in advance, and then overlap it for the first 3 months, and you'll find increased metabolic rate, increased bacterial presence in the gut, increased GLP-1 effectiveness in the system. Microbiome changes, as I said, can take 2 to 4 weeks. Metabolic benefits, 2 to 3 months. Some patients feel the digestive improvements in as little as 2 to 3 days. So remember, probiotics work best with adequate fiber intake. Recommend at least 20 to 30 grams of fiber daily from diverse food choices: fruits, vegetables, whole grains, and legumes. Avoid excessively processed foods and artificial sweeteners, which will harm the microbiome. Hydration, adequate water is essential, especially with the increased fiber. Helps to prevent constipation, supports the overall gut health. Continue the medication. This is critical to emphasize. Probiotics support GLP-1 therapy. They don't replace it. Never discontinue or reduce prescription medication without physician approval. Keep all follow-up appointments with their prescribing doctor. Don't let them fall off of their normal routine. Next slide, please. Some important considerations. Probiotics are not a replacement for GLP-1. Before we can conclude, there are critical caveats to discuss. Managing expectations and ensuring safe, evidence-based care. Emphasize this point clearly. GLP-1 medications have robust, FDA-approved evidence for diabetes and obesity. They've been through thorough, rigorous clinical trials with thousands of patients. Probiotics have suggested evidence, but are not FDA approved for these conditions yet. Probiotics are adjunct support, not primary treatment. Never position them as alternative to prescription medications. What's the evidence-based? Most probiotic studies are still relatively small. Many are short-termed. We need more large-scale, long-term human trials. Optimal strains and doses are still being determined. Individual responses can vary significantly. The field is evolving rapidly. Stay current with new research. You're going to find more and more on Lytese in the upcoming months. FDA status: probiotics are classified as dietary supplement drugs. They don't go through the same rigorous approval process, so says the FDA. Quality can vary significantly between manufacturers. Look for third-party testing. Generally recognized as safe, GRAS status for most strains. Generally regarded as safe means there's been decades of safe use in healthy populations. Most common side effects are temporary: gas, bloating, maybe a little as the microbiome adjusts. Usually resolves in 1 to 2 weeks. Caution: do you have to worry about any cautions here? Immune compromised patients, HIV or AIDS, anybody on chemotherapy, anybody that's had an organ transplant, those are to stay away from. Patients with central lines or indwelling catheters, no. Critically ill patients in ICU settings, those with severe gut barrier dysfunction. In very rare cases of probiotic sepsis have been reported. Very rare. When do you consult a physician? Any patient with serious chronic illness, those on immunosuppressive medications, patients with a history of intestinal surgery or inflammatory bowel disease. It's always better to err on the side of caution. Our professional responsibility is we can recommend and educate about probiotics, but always within the scope of our practice. Collaborate with the medical team. Document recommendations in your patient records. Monitor for adverse effects and report as appropriate. Next slide, please. Let's recap the 4 most important points to remember here. Takeaway number 1. The gut microbiome isn't just about digestion. It's a metabolic organ that influences hormones, including GLP-1. There are 3 pathways. Remember, short-chain fatty acid production, number 1, tryptophan metabolism, number 2, bile acid modification, number 3. Optimizing the microbiome optimizes these natural pathways. Takeaway number 2, not just any probiotic will do this. Akkermansia muciniphila is a lean bacteria keystone. Bifidobacterium lactis B420 has strong weight management evidence. Clostridium butyricum for direct butyrate and GLP-1 stimulation. Multi-strain approaches leverage different mechanisms. Takeaway 3, Lytese Ultra is a prebiotic fiber that feeds beneficial bacteria. It is synergistic with beta-lactus for weight management. It does help to increase Akkermansia. It provides fiber benefits that complement GLP-1 therapy, and it's called a synbiotic, the probiotic and prebiotic together, which outperforms probiotics alone. Takeaway 4, and this is the most critical point to emphasize. Probiotics are complementary, not alternative. GLP-1 medications are evidence-based, FDA-approved treatments. Probiotics support and potentially enhance outcomes. Always coordinate with your healthcare team. Lifestyle modification remains essential, diet and exercise. And make sure you read the bottom disclaimer. Always consult a healthcare provider before adding supplements to a treatment regimen. This protects both practitioners and patients, reinforces collaborative, evidence-based care. The intersection of microbiome science and metabolic medicine is an exciting field that is just now taking off. We're learning more every year about how to optimize these pathways. You know, we look back, and I've talked to some friends of mine. These are the conspiracy people that said, for decades, the food industry tried to make us all fat so that we could sell more pharmaceuticals. So what's going on now that the pharmaceutical industry wants to make us all skinny? It's a good question. But again, when you look at this and put it into perspective, if we do manage to take and cut the rates of obesity in this country somehow, some way, what's that going to do as far as healthcare savings? So again, these are some of the key takeaways. Now, I just want to go through a little bit more on the scope review of Lytese. Lytese polydextrose has been documented to enhance the body's production of the satiety hormones, such as glucagon-like peptide 1. These hormones are associated with improved appetite regulation, glucose control, insulin sensitivity, and triglyceride levels. How many times have we seen individuals, for us providers, where the doctor puts them on a statin drug and their cholesterol goes down and their LDL, their bad cholesterol goes down, and their HDL stays stable, but their triglycerides are still high? This actually can help to reduce triglycerides. It helps to utilize insulin better. It helps to increase glycemic control, enhance effect of sitagliptin. So again, various satiety signals originate in the gastrointestinal tract in response to food intake. In addition to physical signaling, satiety, appetite, and energy metabolism are influenced by hormones secreted by the intestinal enteroendocrine cells. Glucagon-like peptide 1 is the primary incretin hormone secreted from the intestines after food intake. GLP-1 delays gastric emptying, reinforces the feeling of fullness, and thereby reduces food intake. Additionally, it enhances insulin secretion from the pancreatic beta cells, helping to lower blood glucose levels. Elevated circulating GLP-1 levels have been established as a therapeutic strategy to improve glycemic control in patients with diabetes. Lytese, chemically classified as polydextrose, is a carbohydrate polymer that is not digested in the small intestine, but again, slowly fermented into short-chain fatty acids and other metabolites by colonic microbiota. These metabolites can stimulate GLP-1 secretion from the enteroendocrine cells in the lower GI tract. The complex structure of polydextrose confers functional and physiological benefits, such as fecal bulking. So it can also help with chronic constipation. In the studies that have been done on PubMed, on Lytese, so far I found 119. All the records indicated the studies reporting incretins used Lytese as the polydextrose. This product range served as the foundation for constructing the review. So again, out of all of these, Lytese by far outperformed any other form of fiber. 119 studies identified through a database search. 77 duplicate studies were removed, 12 studies excluded. 27 clinical studies were evaluated for eligibility. 13 clinical studies included for the scope of review. 7 preclinical studies included for the scope of review that showed everything that we discussed earlier on today. Now, a few more points in conclusion. Lytese is polydextrose. It's the effect on the gastrointestinal hormones. Lytese showed significant effects on GLP-1 and ghrelin expression in both animal and human studies. These hormonal changes are associated with improved appetite regulation, glucose control, insulin sensitivity, and triglyceride levels. Lytese is scientifically validated, multifunctional dietary fiber that modulates key appetite pathways, particularly by enhancing GLP-1 secretion. The evidence from various studies suggests that Lytese could be a valuable nutritional component in managing diabetes, managing weight, managing cardiovascular health. I want you to think about that line right there. If you took those 3 categories, diabetes, weight, and cardiovascular health, what percentage of the population fall into there? 60%, 70%, 80%? That's a huge amount of individuals that are available to all of us based on the fact about how many individuals are currently on GLP-1s and how we can exactly make those work better. Now, I want to talk again just for a second about another one of the ingredients that's in this prep. I know we were highlighting Lytese, but I want to also just mention calciobiotic, which is Lactobacillus bulgarius. 50 milligrams is in here. A randomized double-blind crossover study in postmenopausal women aged 45 to 65 assessed the bioavailability of calcium from the calciobiotic compared to calcium citrate. This was in the Journal of Frontiers of Science. Study included 24 participants. 3-phase crossover design with a 7-day washout period. Participants fasted overnight before taking a single dose with a standard low calcium breakfast. Each product provided 630 milligrams of calcium and 400 IUs of vitamin D. Measured serum and urine calcium concentrations for up to 8 and 24 hours, respectively. Key findings. The calcium-carrying lactobacillus formulation, which is calciobiotic, showed greater calcium bioavailability with significantly higher area under the curve and peak concentrations in both food, blood, and both in blood and urine, and total calcium mass excreted in urine compared to calcium citrate. They compared this to 1,200 milligrams of calcium citrate for the enhancement of bone health. But the reason I'm bringing this up is when you're looking at this Prep ProBio 3, and you're looking at something that can fit a niche. As I said, those that are overweight, those with cardiovascular disease, those with, you name it, obesity. How many times do we see now, and I know I've seen it in my practice, women over the age of 45 going in for their first DEXA scan and finding out that their bones are already shedding, that we're down into the minus range on our bone health. And then the concern is from the physicians that are working, the endocrinologists that are working with those patients, they're going to say, I'm very hesitant to put you on a GLP-1 because I don't want to affect your bone health adversely. Could this open up a window for another group of patients by supporting the GLP-1, taking care of the side effect and enhancing bone health simultaneously while we're working on getting the weight loss where we need to? Couple questions that have been asked of me. What specific product do you recommend? That's been asked to me again. And I haven't found anything in the literature that's equivalent to ProBio 3. I think it's a very unique product. I will say this, that I anticipate that if you look at all of the new entries in the nutraceutical world for 2026, this is going to be right up there as number one or number two. NAD Plus, I'm putting up there also as one of the top two introductions into the nutraceutical world. How long should patients take probiotics? Again, this is determined individually, but many patients benefit from ongoing use, especially while on GLP-1 medication. The microbiome must have continuous support to maintain optimal composition and to have the GLP-1 actually work. Question 3, can probiotics help patients who want to stop GLP-1 medication? They may help support metabolic health and reduce rebound weight gain, but discontinuing GLP-1 medication should only be done under physician supervision with a comprehensive plan including diet and lifestyle changes. And that gets to be the part that is unfortunately put aside way too often. Question number 4, are there any drug interactions with these? Probiotics generally don't interact with medications. Antibiotics can reduce their effectiveness and again should be at least separated by 2 hours. What about other probiotic foods versus supplements? My comment here is both are valuable. Fermented foods, yogurt, kefir, kimchi, sauerkraut provide probiotics plus nutrients. Supplements offer higher, more consistent doses of specific strains. Ideally, I recommend using both. Question next, is Akkermansia available as a supplement? It's becoming available, but it's still limited. And again, this has been a controversial point about the specific form of beta lactase that's in here and whether it will, in fact, raise Akkermansia levels. And from all of the research that we're seeing that came from the Lytese people that registered, trademarked that, and did all the clinical trials, we are seeing at least a boost in Akkermansia levels. What about cost? Quality probiotics typically cost $20 to $60 per month. I think it's a small price to pay, even though it's not cheap. It's much less expensive than the GLP-1 medication and will improve outcomes enough to justify the investment. All right. With that being said, what questions do we have that I can try to answer? Or did I get everybody bored to tears?
No, I don't think they're bored. They're taking it all in. Just throw them in the chat, or you can unmute yourself if you want. You know, I'm a big peptide fan, right, Len?
I know.
I love GLP-1s,
Give,
GIPs. I like retatrutide too. I like them all.
give me a comment on what you just heard.
I think you put together a great comprehensive support without being judgmental. I think that's big in the industry because 30% of the population is going to be on these peptides. I have dogs. I do believe that they are effective. I do believe that they are beneficial. I mean, I use more than just weight loss peptides. I use all peptides. I use neuropeptides, immune peptides, recovery peptides, longevity. So when you're using something, it's never supposed to be in isolation. And that's one of the issues of utilizing GLP-1s or GIPs. And the dosage is too high because people are not doing the foundational things. So if they
Right.
add in support, that cuts down on cost, cuts down on side effects from overdosing
Hmm.
and, sustains it. It's kind of like people that use GHK. GHK is known as a beauty peptide. You can inject it or you can use it as a facial cream. When people go and do Botox, which we don't want them to do, I usually tell them, like, why don't you do some GHK? It'll make that last longer than you have to inject botulism into your face every other month.
There you
So
go.
it
What's
helps.
your thoughts? What's your thoughts on acromantia?
I like it. Akkermansia is usually low on GI maps. So when I work with all my cancer clients, I do retatrutide, SS31, and thymosin alpha 1. I do a GI map, and on probably 90% of the people with cancer, their akkermansia is null and void. It's done. Not even there. So I do use the Probio 3
Have you
now.
seen the improved levels?
Oh, absolutely. Yeah, you
That's
can
what I
see
did
it.
too. Yeah.
Yeah, akkermansia, short chain fatty acid production, all of that is connected to metabolic function. And, people are using these GLP-1s, GIPs, all of that. They are putting in those necessary incretin hormones that their body's not naturally producing. But if you just do that over and over again without building the foundation, you're going to have to continue to use more and more and more. And that's not the goal. The goal is to
Right.
use less and less and less, right? So, yeah, Christy, all my female mentioned how much weight you have lost personally and what was me? Oh, personally, me using retatrutide, I lost over 20
You.
pounds using retatrutide. So I did a microdose of it once a week. Um, and, started at 5 IU, which is nothing on an insulin syringe. The normal dose out of the gate of what they recommend on a 20 milligram vial is 50 IU, which I never got to 50. I got maybe to 20, and then I started to go back down. So I've maintained that, but I also did gut protocol, balanced my hormones, and I always ate really well. But when I turned 50, things changed. So, and that happens to a lot of us. So hormones get out of whack. And unfortunately, in the conventional treatment of hormones, the education's not there. So they don't know how to do HRT. And it has been so blacklisted for so long because of the silly study by the World Health Organization, who I'm like, who? Yeah, exactly. Now we know that, having estrogen for women is beneficial, but also you have to be able
Hmm.
to metabolize it correctly. And that's not the only hormone. You got to balance progesterone. You also have to look at your cortisol. So all of this thing in combination, if people are looking at peptides to kind of save them or have this sustained weight loss, it won't work. I work with peptides all the time. And what I tell people is you don't get a peptide till you do the foundations. When you do the foundations, we'll talk about peptides. But I'm not giving out a magic bullet because people then tend to overdose them and they get sick, and then peptides get a bad rap, you know?
There's such a great opportunity for the practitioners with this prep to make such a substantial difference
Yeah.
in the outcomes of the patients that just want to maintain and want to stay at that lower dose or are coming off. And I think the science behind this is just so dramatic. I mean, anybody wants to do their own research, just look up Lighties and just go into their website and just look at the research work that's been done on that particular prep, that entity, just dramatic on how effective it is.
Yeah. Remove complete can also raise acromancy with another prebiotic, solinol.
Yep.
Yeah, absolutely. So, yeah,
That'll be in round two of ProBio 4.
nice.
Put
Nice.
that in there because I think that would really help build acromantia.
Yeah, I was really happy to see this come out because, we didn't have a short chain fatty acid accelerator. We didn't have an acromantia builder.
Right.
You know what I mean? And it's needed. So I was really happy to see when this hit the SKUs. That was good.
We got this in an hour.
You did
You did
great.
good.
So
You did
good.
good.
Yeah. I love how you break down each strain. So, guys, if you have any more questions for Dr. Len, remember, he is available. You can reach out to Nutritional Frontiers and they'll get you in contact if you're a healthcare professional and you're here. Remember, Dr. Len is here for your staff as well, as so am I. We'll come in, we'll educate, um, you know, via Zoom. It's very simple. Please utilize us, utilize the education here. And that's what we're here for. We want you to have successful protocols and to make sure you have a successful clinical practice. So,
Amen.
Dr. Len, thanks so much for being awesome as you always are. And thanks
Good to
everybody.
see you, my dear friend. Love you.
I love you too. Okay, I'll see you later.
All
All
right.
right, guys,
Talk
have
to
a
you
great.
all.
All right, bye-bye.